We're here speaking with Dan Newman. He is an MD and also the CMIO at Boston Medical Center. Thank you for coming.
No problem, thank you.
First, can you explain to us what the difference between a CMIO and a CIO is?
I sure can, although it's not well defined across the board exactly what a CMIO is. At my institution, the Chief Information Officer is the person that I directly report to. She really kind of works out with the how of we're going to get to where we're going to be, whereas I'm sort of concentrating more on the what, or where should we go. I tend to be an advocate for the physicians as one of the first things that is my priority. I try to take into account all the different clinical systems where we have the most needs, and then try to bring the clinician concepts to them, so that at the very least there's some sort of defined clinical input in front. So between our CIO, who's kind of more along the lines of, in a broader aspect of how do we get there, how do we kind of achieve the goals that we work with. So getting increased clinical input. I have some technology background to begin with, so I can bring some technology answers and information to the forefront when we talk about these things, but I tend to be more of the clinician side that can at least understand where the technical people are coming from.
Then would it be fair to say that as a CIO is mainly concerned with laying the tracks, the technology side of it, and then and possibly the usability side of it, and then a CMIO would be interested in the dissemination of the information, that it's understandable, but it's in the speak that a physician would understand.
Yes.
And as a clinician yourself, that's how you enable other clinicians to be able to embrace the technology.
Absolutely, yeah. I think that there's, my role tends to be to try to convince people and to try to work with them on what's the best thing for how they use these systems, how do we use them in real time with our patients, and to do some testing on my own, etc. Versus also bringing back their concerns into the IT department. So it kind of goes both ways. Part of me is kind of proselytizing and trying to discuss with the clinicians how they use these, and also to say, when they really have a problem, bring it back and say, you guys don't understand why this is such a big problem to them. I think it's always amazing that when you ask a clinician what they're most concerned about, oftentimes it's not what the IT group would think is their biggest priority. So, for example, a very small change within the clinical system might have a bigger impact to the clinicians, what they're doing on a daily basis, than developing the most wonderful thing that's ever happened in the back end of IT. So, kind of bringing that view to the entire IT session is probably really important.